One of the great things about coming to Fort Sanders Regional is not only do you get the acute stroke care that I can provide, but you also have the neurohospitalists, neurosurgeons, and most importantly, the rehab hospitals to help you with your recovery.
Well, I was in the kitchen helping her, and I dropped the dish rag and I reached down to get it, and that's when it hit me.
That was a very hard day for us because I had never saw him in the way he was, but I knew he must be having a stroke.
TPA is a medication that dissolves blood clots. It's very good at dissolving small blood clots, and it can be given very quickly in the emergency department, but it's not quite as good on the larger clots. Mr. Trentham's case was very straightforward. We were able to take a catheter up into the brain and pull the clot out with a small aspiration catheter.
As time goes on, if they do come in with a stroke, we're really determining what treatment's going to be best for them longer term, and also kind of how do we get them over the symptoms of a stroke? How do we make them better? How can we get them back to living independently and doing all the things that they used to enjoy doing before maybe they had their stroke?
After we've retrieved the blood clot and there's improvement, the most important thing is not to have bleeding or any other complications. So we put these patients into the ICU to make sure their blood pressure stays low and to reduce their risk of bleeding.
After we treat somebody for a stroke, whether it be with TPA, whether it be with pulling out that clot, what we're doing is we're stopping by on a daily basis. We're checking to see, number one, are their symptoms getting better? At the same time, what we're doing is we're working with our therapists. We're getting our therapists involved in taking the patient, and we're saying, what can we do to restore that level of function that you had before? How can we make your body stronger? How can we make the brain work around whatever pathways may have been damaged in the process? Before
he came to the hospital, he was just all slumped over and couldn't speak right and couldn't use his arm and all of that. Well, after they did all of that, when I got to go in, I was amazed because he could do that now. He could do that.
Yeah, when I was in the hospital, they took good care of me. I was in here about 2.5 days, I think.
Dr. Woodward was wonderful. He really stood by him, and his assistant too. They were right there, as we say, Johnny on the spot. I'm so proud of him because he does everything he wants to do just like he did before he had the stroke.
The most important thing, if you think you're having a stroke, or if you see someone you think is having a stroke, is to call 911. Time is of the essence.
If someone comes here with a stroke, they're getting top-level care at the cutting edge of research, whether it be through medicines, whether it be through our rehabilitation program, whether it be through a surgical procedure to remove that clot. You can be assured that you're going to get the best that medicine has to offer.
I would recommend Fort Sanders Regional because they can take good care of you up here, more equipped to take care of you.